Dr. J, you have a program that with I think, a brilliant name because everybody today wants a little bit of peace of mind. And
Don't
that
we
is, in
all?
fact, the name of the program that you've created. So tell me about that.
So I'll start off by just for all the listeners who are either watching or listening, just to understand, more about me before I jump into the program. But I've been on your show before, your channel, your podcast, whatever we're calling it. And I am a naturopathic doctor, and I'm based in Ontario, in Canada. And essentially, what Peace of Mind Method is about is it was me taking all of the naturopathic principles and everything that I had learned throughout my entire biomedical education and then my extracurricular education. So, in yoga and meditation and breath work and nutrition and lifestyle and all of that, and mixing the holistic lifestyle with the actual science behind everything that happens in the human body and putting that together so that we can optimize our mental health. And that is where I came up with Peace of Mind Method. It is a program that, I think in the last 2 years is the last time I was on the channel. It might have been a year or two ago. And it was always geared toward the high achieving style patient that I tend to work with.
Mhm.
I find that we're a very unique breed of individuals, and I'm saying we because obviously I am one of those people. And the program was designed for myself, and then it was extended to my patients because it was proving to work so well in so many different case scenarios. But it was always geared toward this high achieving, perfectionist, high functioning, high performing style patient because those are the people that want to really work hard on getting better. It's not for the patient who kind of takes the back seat and waits for someone else to help them. It's really about a patient who's ready to step into taking action and taking those steps to getting themselves to that place of whatever better feels like to them. So if I backtrack a little bit, which I did mention prior, the program was designed for me. It was designed for me to work on my anxiety and depression. And throughout the years of me doing that, like all the interesting things I learned through my science degrees and then also through my extracurriculars that I was engaging with in that holistic world. And I put it all together in a very organized, concise way because high achievers love a checklist and we love to be told what to do and we like to win at what we're doing. So that's kind of how it all came to be. It was an organizational tool for myself and then it became an organizational tool for my patients and a blueprint for them to follow so that they knew, am I doing the right things to get to where I want to be? Or am I following random people on social media or listening to my friend's sister's ex-husband's cat about how I need to work on my mental health and kind of cherry picking all these random things. So it's very clinically driven, very science driven, evidence based driven, research driven, so that we can get to the goals a lot faster instead of wasting our time.
Okay. You wouldn't call yourself a coach, though, or would you?
I would say there's an element of my job that's always going to be coaching my
Hmm.
patients, but first and foremost, I operate as a doctor. I'm there to have the doctor-patient relationship. Um, Again, there's gonna be coaching moments where when you're with a patient, you're gonna be doing motivational interviewing, or in my program Peace of Mind Method, I have group calls where I step out of the doctor's seat and now I am just engaging with my patients as a human being. So there is a lot of coaching that goes into that. And then I would say, maybe in a passive sense, because of my social media presence on Instagram and through Facebook, that there's gonna be that element of it's like passive inspirational coaching, right? People are seeing that I am living, breathing, and doing the things that I do in my program. And it is inspiring for them to watch it and be like, okay, yeah, I should be doing that. Or if she can do it, I can do that because our lives really don't look that much different. Or even just the reminder, the constant reminder. I don't know if you're on Instagram, but you open up the app and you see on someone's story, like, oh, they did their meditation and their breath work and their yoga and their walk and they're out in nature and they're doing all the things. I can probably go get that done as well. Or I forgot that I needed to put that into my schedule today. So I would say, in a traditional sense of the word coaching, I'm not like sitting there like Mel Robbins or like Tony Robbins. It's funny that they have the last name and like cheering people on, fist bumping into the air. But I take a very realistic approach of this is all achievable. This can all get done. This isn't that complicated, and you can definitely do it too. So it's
Mhm.
less of a coaching of let's do really hard things. And instead, I take the complete opposite angle of this really isn't that big of a deal. We
Mhm.
can all get this done. We all have time in our day. I don't know if anyone warned you before we got on the call, but I'm like very pregnant right now, like ready to give birth pregnant.
Oh.
And, we all have we all have complexities to our lives that it doesn't mean that the scheduling or the self-care or whatever, that we're committing to do for ourselves, it doesn't need to go, fall out the window.
Mhm.
It really does need to be incorporated as a part of our lives. And I think that that is the best coaching technique is being a real person and having people see like, oh, you can do that, so I can do that. Not because I, live a crazy lifestyle that allows me the privilege to do all these things. It just takes hard work and
Mhm.
commitment and consistency, and then you can get to the other side.
Well, I appreciate that honesty because there's so many quick fixes out there that people are drawn to. But it sounds to me like you are motivating your clients, you're inspiring them, you give off a positive vibe, and you're giving them hope because a lot of them need that very much so. But why do you think, Dr. J, that there are a lot of people these days that succumb to anxiety and depression? I guess is it just the state of the world? What's your take on that?
I mean, I could probably spend 5 hours talking about this concept. I think that there's mixed components that are going to result in people having anxiety and depression. Obviously, over the last 5 years, I mean, we saw the world take such a major shift. And I was reflecting on this while I was driving the other day. Like, how did I respond to the entirety of COVID? And how did it change my mental health? And how did it change the industry in general? Because obviously now I get to practice online. We're online right now. Did that really change people's mental health? Or did it give us this time to slow down and kind of get exposed to the concept of whatever's happening right now isn't normal. The things I'm feeling inside of my body aren't normal. The experiences I've gone through my life so far, those aren't normal. I think that people really started getting educated because they had the time. And then unfortunately, there was a life event that forced it upon people to be like, introspect, you don't get to do anything else right now. But it did gain popularity in the last few years. Obviously, for me, anxiety and depression preceded this. It's something that I dealt with my entire childhood, teenhood, adulthood, presenthood. Like it's gonna always be there for me. So it's not new in my life, but I did see this big boom since the whole world went online. Not that the online world is bad and it's causing anxiety because people don't know how to communicate anymore or, interface in that deep connection sort of way. But I think that people got more educated. They learned how to obtain more information. And a lot of people run rampant with information that they don't really have in good context, right? So do I think the world is broken and that's why we all have anxiety and depression? No. Do I think that every person that I interface with has anxiety and depression? No. Right? But there are a lot of people I see where I'm like, you don't even know that you're dealing with something mental health related.
Mhm.
It's a complete the opposite mirror reflection is these people are going through their lives, going through the motions, being those high achiever type people. Their nervous system is in this go, 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 I'm addicted to chaos stress state. And then suddenly they're in their 30s or 40s and they're like, whoa, what's happening inside of my chest? I need to see a doctor. There's something wrong. I have to get this checked. I need to go get this medical thing done. And they're not recognizing that what's happening is like it's a broken human condition, right? We're not intended to move at the pace that we've moved. People really struggle with balance. I think that that's probably one of the most common things that I see is People end up in an anxious state because they're not paying attention to these small little details that I'm trained to pay attention to. People end up in a depressed state because they're not processing things. Because if we look at the generation before mine, it was the generation of shh, don't say, right? Don't say, don't talk, don't do, ignore, don't pay attention, everything's fine. And now I'm a part of the generation where everyone wants to pick everything apart aggressively and look in depth and go deeper and deeper and deeper. And there has to be a balance between the two. I think that, a lot of my patients are now, I, I would say between the 25 and the 45 bracket mark, which is that perfect sweet spot of we were raised one way, but now we're starting to learn all these new things. And how do we integrate the in between, right? With
Mm.
all of the knowledge out there, with the podcasts, with the social media, with the books, with everything we're seeing, on TV and in movies. I just think that everything's being presented so differently. The generation above they're a little bit confused still about what's going on. They're like, why is everyone so anxious? And then the younger generation is like riddled with so much crippling mental health issues. And you're like, those aren't really mental health issues. That's just growing up, right? So I would say, why do I think everyone, is dealing with it more these days? I think it's like a sign of the times, but not because of the way of the world. I think it has to do with the information that we're being exposed to. And then there's a portion of the population that's going to be philosophically and intellectually stimulated by this and want to do that work. And then there's the other people that are going to get crippled by that education, right?
Mhm.
So I don't know if that's a clear answer or if that's like giving exactly, what it is that anyone would want to hear. But I don't think that mental health is more prevalent now than it was before. I think that if I existed as the doctor that I am and I was talking to my parents' generation, I'd be like, and you have a problem, and you have a problem, and you have a problem. And it's very obvious to me. But I think that we just in this pocket of like 25 to 45 right now is the everyone's brain is developed enough to be like, let's navigate this in a normal way. Let's
Mhm.
recognize what's not normal. Let's repair. Let's try and optimize. Let's be the best for our children and the next generation. Let's repair our relationship with our parents. I just feel like there's this pocket of people that are ready and willing to do that work.
Mhm.
And I don't think that there's more people that are struggling with mental health stuff now. I just think that it's more acceptable to talk about it and go into detail about it and recognize that you can want to improve things without being so sick that you need to be like hospitalized, right? In your generation, it was like if you have something like you got to go to the mental institution, we're going to lock you up, right?
Yeah.
And in this like middle, I can't even call it middle aged, let's call it like the youth these days from 25 to 45 is they're just ready to do that work without panicking as
Mhm.
they do that work. They're not afraid of it anymore. So I don't know what happened in the last bunch of years.
Hmm.
I was ahead of the curve. People thought I was super weird for talking about it. and and not it wasn't accepted, Like I grew up being like, "Hey, parents, I have XYZ." And they were like, "No, you don't." What? Right? So it was just it's just different. It's different now.
That does make a lot of sense. And you're absolutely right. Years gone by, decades gone by, people didn't want to talk about it, the stigma. And so they didn't seek help. And now, thank God, it's out in the open and people are seeking help. And so that really seems to be one of the major differences. You mentioned about the information overload. I know even me, I get stressed by all the information that's coming out. And, trying to sort of filter all of that so that I can only get the stuff that I need and not all the rest of it. So, what's your take then on technology? I mean, we've got all this information, all these tools. Wouldn't you agree with me that that's kind of stressing us out also?
Yeah, I would say I have a love-hate relationship with technology. Like
Hmm.
Google's great sometimes. I had a whole rant last week on my, group call for Peace of Mind Method and to my everyone who receives my emails. I call them Wisdom Wednesdays, in my community. So like thousands of people received an email from me a few weeks ago about AI and ChatGPT and how I
Right.
feel
Hmm.
and how are we really supposed to navigate and contextualize all this mental health information without understanding the foundation of where it comes from. Like, how can you understand treatment plans without understanding biochemistry? How can you supplement yourself or take certain things or even understand your medication without understanding the science behind it? I don't think that AI or technology and information overload, I don't think it's filling any blanks. I think it's confusing people more. There are times where I've seen it do wonderful things.
Mhm.
And also allow my patients to not send me an email or send me a text message or send me a Facebook note, right? Like people can figure out basic things by themselves, but I still really feel that the doctor-patient relationship is at the base of everything that we do, especially mental health related. You can't improve by getting advice online. You can't even, how many people improve by getting advice from a friend, right? You have to be a very special type of person to just listen to someone and take information and now apply it all and then stay accountable to it. So there is something to be said about the real, I'm going to call it face to face. Everything I do is online. This is my face to face. But there is something to be said about that. I do think that it transforms patients and it does help them remain accountable and stay motivated and also trust someone, right? we I went on a whole rant about you shouldn't really trust all of your professionals, all your doctors, and they don't know everything. We don't have access to a bank of information in our brain. We still need the online world. But we also still need contextual understanding of what it means when you Google something.
Mhm.
An interaction, a contraindication, when you should be taking something, when you shouldn't be taking something, when something's helpful for you versus when it's not, right? I even go into nitty and gritty details in my program of what types of meditation is good based on who you are. What types of breath work is good based on who you are and the symptoms that you have. We can't all just blanketly being like, breathing's good. Okay, what kind of breathing? How are we breathing? When are we breathing? How are
Mhm.
we meditating? What type of meditation are we doing? How long are we sitting for? There's so many details that go into this. What are we learning when we walk away from lessons like that, right? So I think that doctors, or at least mental health professionals, we're always going to be important. We're never going to be obsolete
Right.
because we need the interaction of that doctor and patient, which they have researched time and time again. Even if we don't do anything in an appointment, treatment wise, people still get better when they have a relationship with their doctor. It's
Mm.
weird, right? I can
Yeah.
give you a placebo and you can still get better just by engaging with me, right? And that's not, I'm not tooting my own horn. I'm saying that they've done research on this replicable over and over again, that when you feel cared for, you do better, right? AI is not caring for anyone. Podcasts aren't caring for anyone, even though we like being on podcasts. Watching content, being on TikTok, saving something, sending it to a friend. It's not changing who you are fundamentally as a person.
Mm.
And if we could all change by ourselves and in a vacuum, the world would be a very lovely fixed place, right? It does
Mhm.
take having someone challenge you in the moment and be like, I'm hearing you say this, or I'm receiving that information from you, but what I'm actually perceiving is something different. Or I'll call out my patients all the time and be like, I gave you this homework. Like, did you do it? And they'll be like, yeah, well, I thought about it, but I didn't execute it. And I go, okay, that's fine. How many times would you like me to let you fail before I get a little harder on you, right? Because
Mm.
you're not here to repeat your concerns, complaints, and like triage list. You're here to create a difference in your life, right? So you have to take those steps to get to the next place. So I think that information will still always be information. And that's really all it is. Because if you have access to information, but you can't apply the information, what's the point of it?
Yeah.
Now you're
You
smarter.
Yeah, exactly. You said something earlier on that really struck me that, a lot of us take pills. We have no idea what's in the pills. We don't even know what they're actually doing. It's just,
Yeah.
the doctor has prescribed it. But that takes me to the topic of naturopathic medicine and practices, which you are very much involved with, or, the traditional medical doctor. I went to see my doctor the other day. He spent, I think, a total of 2 minutes with me. He wasn't really interested in what I had to say. He was looking at a chart of some blood tests and went from there. The impression I get is that it's good maybe to have both our traditional doctor, but also naturopathic. And correct me if I'm wrong, but if I was to, hire you, you'd probably spend more time listening to me. And that speaks to the relationships you spoke of earlier that seems to be missing from traditional medicine. So I've just kind of touched on what I think are some of the advantages to what you do. Maybe you could expand upon that.
Yeah, I would say the biggest reflection that I can give back to this is yes, I spend more time with my patients. I spend an hour with them most often, is the
Wow.
time slot that people spend with me. I look at a lot of lab work. I spend a lot of time explaining to patients what their lab work means because their doctor didn't, right?
Yes.
And
Mhm.
interestingly enough, if we go back to the little topic about going on Google and having information overload, is if you don't understand the context of what you're looking at in your lab work, and now you're like, well, my doctor gave me 2 minutes, so I'm going to go home and Google that. And now you have a whole AI generated information piece about what's wrong with you, what's wrong with your lab work, what you could have. Now you are extra confused and you're scared and you have
Yeah.
no one to ask these questions to because they only gave you 2 minutes. So you're like, do I have this thing? How do I repair this thing? Do I blindly take the thing that they asked me to take? Right? So I spend a lot of time with my patients after they go to the family doctor or their specialist, even, which is
Ah,
crazy to me. And then they come to me and we break down what all of the lab markers mean if they're out of range. How do we improve them in a natural way before we have to take the step to take a medication? Are the levels at a number that I actually believe medication is going to be the most helpful route until we get to a certain reference range? And now I feel comfortable saying, hey, let's navigate it in a more natural way, right? So just because I'm a naturopathic doctor, I still very much so practice medicine and evidence-based styles of practice with my patients. So I don't have an opinion, so to speak, on how someone wants to navigate things. I have a negotiation with my patients and ask them, what are your goals? I'll tell you how we can get there, right? If someone says to me, I want to work on my cholesterol, but I don't want to give up drinking, okay? I mean,
right.
it's it out loud. You're like, that sounds stupid, right? However, if I have a patient who says, listen, it's part of my life, it's a part of the social component of my life, it makes me feel mentally well. It allows me to put the pause on things. It allows me to enjoy parts of my week that I normally wouldn't enjoy. And I'm starting to hear the value that maybe that alcohol is to them. Not that they're an alcoholic, we've screened for all the other things. And we've tried to maybe cut back in the recent past, and it was too difficult. It was making them suffer with things like anxiety and self-esteem issues and feeling like a failure every time they showed up to an appointment. I now, as my job, I give informed consent and say, hey, let's talk about the relationship between, for example, alcohol and cholesterol, right? But now let's work together as a team to find something that's reasonable to you that feels achievable so that A, you don't feel like a failure, and B, you don't feel like you're losing out on your life, and C, your mental health isn't suffering for whatever reason. And I call this informed consent, right?
Mhm.
We need to meet in the middle always as doctors and patients because you might want one thing. I might want another. But if I can't negotiate with you, someone leaves feeling like they've lost, right? If the patient feels like they've lost, that's a failed appointment, right? Because if you
Mm.
didn't walk away with homework or something to do in order to improve whatever it is, your lifestyle, your mental health, your physical health, I don't care. If you don't have an action plan for yourself of how you're going to get to that next step, and I was very rigid and was like, this is the only way to do it. If you want to work with me, this is how it has to be. You're not allowed to do that because it's bad for you, right? The patient's not going to leave wanting to do anything. It's not motivating. And if we, reference back to before, that's terrible coaching.
Yeah.
My way or the highway. Step into my office, let me help you, but let me only do it my way. And I
Mm.
think that that is what, and I don't know if other naturopathic doctors operate this way. This is just like a personal decision that I made with working with my patients is I am more likely to get a result out of you if you leave an appointment feeling happy, right? Oh my gosh,
Mhm.
she said I didn't have to do that. I don't have to do it 100%. I don't have to be perfect about it. I'm
Hmm.
allowed to kind of like make my own storybook and how I'm going to get there. They're motivated to want to do that because they're like, oh, I'm not being forced. This isn't like me being punished for being bad.
Hmm.
There's many different ways to skin a cat. I don't
Right.
know if people like that reference anymore. But we have to be willing to do things differently and have that informed consent. Another conversation I have with a lot of patients is, are you sure that you want to be, going on that medication? Do you understand the side effects of it? Do you understand what it interacts with? Do you understand what can happen if, let's say, in a mental health medication situation, if the medication is intended for a 4 to 6 week trial and now you're on it for 6 months? Do
Hmm.
you understand the repercussions of what happens when you just tell me you want to come off of it after 6 months?
Hmm.
Have the plan put in place prior to going on the medication, right? So I would say a lot of what I do is, yeah, looking at labs and explaining things to patients and going through the science because I have the time to do that with them. But it's also a lot of informed consent of these are your options. These are 5 different options. Let's play out each one. Pick your favorite. You hate them all? That's fine. Pick your favorite. And then we're going to navigate how we get to that goal as efficiently as possible, right? So I would say that that stops my patients from making a lot of mistakes on their treatment plans. I see a lot of people doing like quick mental health medications in order to take away their pain and their suffering very quickly, as opposed to being like, let's just pause for a second, because what you're asking for is for everything to go away. But let's not ignore the concept that if you go on this medication, that it could make those symptoms a lot louder for 3 months. Is that something you're prepared for? Right? Because it's
Hmm.
not always black and white and cut and dry, where
Right.
you just get to snap your fingers, have the magic pill, get what you want. And I think that that is such an important conversation that I get to have with my patients and my community members that I don't see many doctors having with their patients. I see patients as anything can be worked through, anything can be worked on. You are not a risk to yourself and me, obviously, after an assessment. And I can deem when someone is capable of working on something. I want my patients to have all the autonomy and the confidence in themselves because that's a foundational requirement for them to succeed. The way that doctors, or traditional doctors, medical doctors, 15-minute in and outers, 2 minute in and outers, the way that they look at their patients is everyone's a flight risk. I need to not save everyone, but I need to stop everyone from anything bad happening. So medical doctors are very risk adverse, right? They want to remove the concept of any suffering, any potential suicide, any potential psychosis, anything where the patient might be in danger. Okay. When I'm with a patient, I can suss out in the first like 15 minutes, like, are you a danger to yourself and others? Like, are we jumping to this? Are we just feeling scared within our bodies and don't know how to self-soothe and navigate this? So we're just going for the quickest option. Is going for the quickest option going to give us the quickest result? No. Right. So that is a conversation that I have with my patients always. And I'm calling it informed consent because I think that, I mean, the way that I was taught was your patient needs to understand everything before they make a medical choice, right?
Hmm.
We understand the word consent. Consent somehow in the medical industry, which is like the most, should be the most consented industry because it's your body and it's your right. But here we are knowing nothing about it, being like, well, the doctor said I should, so I'm gonna, right?
Yeah.
I've had doctors put, I'm saying doctors in general, like all the different patients I have that have worked with doctors, put their patients on medications for diagnoses that once I've spent enough time with them, I'm like, you don't even have that. So why are we
Right.
on this medication? And what are
Right.
we expecting it to be doing
Hmm.
if that, like, if you spent an hour biweekly or monthly with a patient, you get a very good understanding of who they are.
Yeah.
And I don't think that, and I know that science and evidence-based research will tell us if you fit the criteria, this is the treatment protocol. That's how medicine works, right? It's
Mhm.
not doctors sitting there going, I know what medication will work best for this. We have it's kind of like a flow chart, right? if this is a symptom and this is what you got on your GAD-7, which is like an anxiety test, or this is what you got on your depression scale, it's like we're going to try this first. And then if that doesn't work after this amount of time, we're going to pivot to this, and then we're going to try that second. And if that doesn't work second, then we're going to add this one on top of that one. And you're like, "Whoa, this is not individualized care anymore." Right? And that is also something that I tease apart with my patients a lot, which is, what do you have? Do you have anxiety? Do you have depression? Do you have ADHD? Do you have, CPTSD? Do you have just a lot of feelings? Do you have something that can just be navigated without medication? Do you have a mood disorder? Do you have a personality disorder? Do you have OCD? Right? There's so many diagnoses that kind of blend in this ugly way with science and evidence and the best tools that we have to rule out what conditions people might have. But I just find that treatment, it's not as good as doctors lend it to be. And that sucks, right? Because we want to hear we have a really good medication for this and it's going to help you with your symptoms. And what I say to my patients is, we have medications. The best thing that you can do is try and we'll find out.
Yeah.
Is it gonna work? I don't know. I can't promise you. Is it gonna
Mhm.
make it worse? I don't know. Can't promise you. Is it gonna
Mhm.
get better in a week? No promises, right? So
Mhm.
if you were given that information when it comes to mental health specifically, I feel like people would be a lot less inclined to jump on the bandwagon immediately of like, I need a medication and I need it now. It's different than cholesterol. It's different than having an iron deficiency. It's different than, having blood pressure issues. Obviously, all those things could be navigated naturally as well. But I'm just saying those medications work better and have a better success rate. And that's why it's easier to go into an appointment and be like, I got cholesterol issues. I got to be on a statin. No, you don't. But it's just easier to say it for the health and the lifestyle stuff versus the mental health stuff. And that has
Mhm.
been, I think this last year, like 2025, has been a lot of conversations with my patients about medication selection based on accurate
Mhm.
diagnostic criteria
Mhm.
because people think they have anxiety. And then I'm like, this is not anxiety. This is like mental type OCD. And
Right.
if everyone's taking an SSRI, but that's not the medication that's going to work best for these obsessive thoughts that you're having, right?
Mhm.
Now we're in the wrong area code. So
Mhm.
that's a lot of like, I would say the medical work that I do is offering that informed consent, the conversations, and then making suggestions
Yeah.
of
It,
like,
it,
yeah,
yeah. It sounds like a deeper dive.
oh, yeah,
It's looking at the broader picture, which is a huge value for people. And I think you've got a lot of credibility because you yourself have experienced symptoms. So, a patient of yours can relate maybe better to you. So there's a lot of good here. Just one last topic I want to touch on with you, Dr. J, and that is guilt. And I'm wondering if that goes into your practice, especially with the high achievers who feel guilty about spending so much time at work and so little time with friends and family. I'll tell you, in my case, I struggle with guilt all the time, and it can eat you up. So, are you dealing with that as well?
yeah, I would say guilt and shame are probably two of the biggest emotions that I navigate with patients on a daily basis.
Okay. Okay.
Not just because how am I supposed to find the balance and put the time in toward myself? Like that's not even the biggest place that I see guilt and shame. I see it a lot like even people putting in too much time into themselves or not making the right decisions for themselves.
Mm,
People knowing that they know better, but then they're still failing. And
mm,
it's not even just, oh, I needed to spend time with my kids and my partner and my family and do all these chores. It's I know that I need to be resting in this time, but I also know that I need to be doing all these other things for my mental health. So how am I supposed to decide which one to do?
right.
I also see a lot of guilt and shame around like people perceiving themselves both in the present and in the past, right? Like people who are going to go and do all that work, that self work, and open up the layers of who they are. And then they're like, I don't like who I am, right? And
Mm.
that can be very destabilizing, right? Because if you are talking about a high achiever and a perfectionist, what they want to do is they want to open it up and go, I can fix this now, right? So it's not just about time and it's not just about feeling bad about not making the right choices. It's also having this deep-seated sense of guilt and shame. Like, how did I not know this before? How have I been operating like this my entire life? How could I have been so stupid? Right? How could I have made that mistake? I already learned that lesson when I did XYZ, even like patients in my program who are working on different tools. And then they'll get in a situation where they're really activated and they'll be like, wow, I can't believe I screwed the pooch on that one. Right? And I have
Yeah.
to come in and be like, that's life. You're actually gonna screw up multiple times. And it's gonna continue happening for the rest of time. And that's normal. And it's not about being perfect 100% of the time. I love this ratio of being 100%, 80% of the time. Because if you can do a really good job a majority of the time, then you are actually allowed to fail some of the time, right?
Mm.
And if we can not have guilt and shame about that, right? And be like, oh, I'm giving myself this 20% wiggle room. I am allowed to screw up. I am allowed to do bad. I am allowed to make the wrong choices. It gives you this moment of like, wow, I can be proud of the 80% instead of needing that 100% perfection all the time. So, not just time management, but like it's like emotional management of
Yeah.
being okay with who you are and okay with screwing up and
Mm.
okay with not always doing this linear projection of better, 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 better self-improvement. Everyone wants that like one line going up. And, we've seen this little diagram of, oh, actually, life looks like this, right?
Yeah.
And it's like goes up and down and up and down. And to my patients, I always tell them, you need to learn how to ride the wave because
Mm.
life's going to keep happening, right? If we have this expectation that we're always on, now we're having the same expectation of our nervous system from before, right? Which is work hard, play hard, be a really good partner, be a really good parent, be a really good dog parent, be a really good friend, always show up for everyone. It's like you can't. You will crash. You will crash and burn.
Yes.
So there has to be this ebb and flow to life. And I find that with a lot of my high achievers, they don't like that concept. They're like, well, I can control everything. I can be good all the time. I can always be on. I can always know the right thing to do. And if you continue having that mindset, you will never actually find peace. You will never actually be happy because you have to give yourself this allowance or that space of being bad, putting your hand in the cookie jar, doing the wrong thing so that you can, in perspective or duality in the flip sense, be proud of the moments that you do really well, right? You can't just be like happy and proud and amazing all the time. It's not how life works. And I have that conversation a lot with my high achievers because they don't like that idea of it's like they struggle with not being good enough as it is. So that's where the guilt and the shame comes from. But we gotta slice that.
Yeah. Yeah. I want to end it on that note because you have given me and our audience permission to be human.
Yeah.
Uh, and thank you for that because that is empowering. And I instantly felt better hearing you talk about that, that I'm allowed to, not always be perfect. So I thank you for that very much, Dr. J. And I want to thank you for talking to us today.
My
And
pleasure.
if you don't mind, we might check in with you again in a year from now and see how things are going and see if anything has changed.
I mean, definitely with me, nothing will have changed. I want to say like I'll
Okay.
say work wise, life wise, mindset wise. Like I just think that the most interesting thing will be watching me use all of the knowledge that I have toward a small human brain. Because I'm so fascinated by the nervous system and how brains function and how we learn and how we process stuff,
Mm.
and how I navigate change and challenge as it comes. Like to the point of not being perfect. I actually love when things go sideways. I love when things go wrong because it gives me this opportunity to say, how do I apply my strategies to this situation? right? How do I
Mm.
not succumb to this spiraling and the pain and the suffering of this experience? And how can I, it's not rise above, but it's like rise to the challenge of what this is and let it be really messy because that's what makes you a good doctor. It's what makes you a good coach. It what makes you really personable is that people are watching you be in the mud with them. And I
Mm.
think that that is really cool. So
Wow.
I'm very interested to see what I end up like with a screaming, crying baby and sleep deprived and everything is just absolute chaos and my dog also needs me to still be the best dog mom on planet Earth. Like I'm looking forward to seeing what it serves me on the dish so that
Mm.
I can be like, "Oh, how do I, lean into my meditation principles and my breath work and my nervous system regulation and my balance and being okay with being 80% good and 20% really bad." Because we can't learn without that bad area, right? And I think that it sounds obvious to me, but maybe people don't realize that is that you need something bad contextually to open your eyes to, hey, I want to improve this,
Yeah.
right? You need the scenario, you need the context, you need the, oh, these are my ugly patterns. Let me navigate them better. Let me be aware of them. Let me patch them up and make them stronger. So
Mm.
I don't think that I'm going to change per se. Maybe my life will look different. Maybe
Mhm.
by the next time you see me, I will unfortunately be pregnant again. Um, but I think that it's going to be such an interesting experience for me, and I'm looking forward to the mental health challenge that it's going to provide. Not because I'm a masochist, but because it just
Mm.
helps you learn. It helps you lean in. It helps you like put your money where your mouth is, right?
Right.
Like we're all
Yeah.
fine until we're put in, under the fire, you know?
Yes.
It's
Yeah.
it's an interesting experience.
Well, it's a great attitude. Bring on the challenges. Thanks again, Dr. J.
My absolute pleasure.